also know that elbow function is extend hand into the air. If we have the problem of stiffness, we will lose of the elbow function. There are several causes of the elbow stiffness along the literature. But if we classify the cause of the elbow stiffness along the possibility of the surgical treatment, we can divide into number one, mechanical block, nerve, and instability. The mechanical block. This is a mechanical block such as like osteophytes, bone spur, heterotopic ossification, capsular contracture, and also the loose body. For the nerve, cutaneous nerve injury can develop elbow stiff, and even the tension on the nerve when the elbow return to motion. And also the post-correction of the stiffness by surgically can cause a neuritis. Instability can cause the ulnohumeral maltracking and radiocapitular maltracking. Here is the example. This is a non-union of the basal coronoid. We need to revise head and screw and reduce the basal coronoid. After the operation, ulnohumeral articulation returned back to near normal, but the patient still cannot bend his elbow properly. So we need to correction with the reconstruction annular ligament and reduce the radial head back. So radiocapitular tacking come back. He can't bend his elbow properly. Arthroscopic surgery is a tool. They have a benefit in minimal invasive surgery, have a less soft tissue damage, and also have a precise working. Example, in this video kit, you can see that there is a lateral epicondylitis and divide the ECRB and capsular dividement. So the instrument can work well and precisely in interarticular lesion. Another benefit of the elbow arthroscopy is the magnification. So it can improve the viewing of the from the interarticular region. In this video, you can see that this have a nice and huge and big and clearly visualization. However, elbow arthroscopic surgery still be the most natural choice for arthroscopy when compared to other joints. For yourself and your patient, I am not willing to convince the people to do an elbow arthroscope release because it is a fabulous surgery. There are factors to make the success and safe for your patient when to do elbow arthroscopy correction for the stiffness. You need to know yourself. Experience and skill is important, and you need to leveling the procedure. Basic knowledge in anatomical of the nerve, you also need to know, and also the setup. And just stick to the step can make sure that you will not lose and have a good guideline for yourself to do the elbow arthroscopic surgery. From the experience view, some surgeons have a background from shoulder arthroscope or knee arthroscope or even from the wrist arthroscope. Those backgrounds can involve and decide what the implant and instrument that they can use. For the leveling of the procedure, I can divide the operation to be basic and advanced. For the basics, such as like department, capsular department, or even the synovectomy. Another one like remove loose body or tissue biopsy also be the group of the basic one. For the advanced, the examples such as like a collateral ligament reconstruction through arthroscope, stiff elbow capsular release, will also be the advanced ones too. Fracture fixation, endoscope or bursoscopy for olecranon bursitis also be the advanced, and the recent one may be like a dissect repair. For the evaluation of the nerve, Bachman report in JCS 2015, they showed a good validity to evaluate how far between the heterotopic ossification from the median nerve and the tibial nerve. That is a good evaluation because most of the time when we do work up on the heterotopic ossification, most of the time we use a CT scan to do that investigation. So they show that the CT scan quite safe and have a good validity results in that. Step in elbow arthroscopic surgery is a good for the guideline for you to do the arthroscope with the step. It will not make you loss of the operation. They have a 4-step inside. This step is recommended by Dr. Otoscope. Number 1, step in. It means that when you go in the joint, you need to know where are your cells, such as like the olecranon burst, olecranon fossa, lateral cutter, medial cutter, or in the front of the elbow. And the step 2, extend the working space because the elbow joint quite narrow. So sometimes you need to divide some soft tissue or even some of the bony work to create a good proper space for working. Step 3 is a bony work. Bony work is include like osteoplasty or chondroplasty. And the final step is the capsular working, soft tissue release. Next is the disease that show the good benefit when you sticking with the step of arthroscopic surgery. Hypertrophic osteoarthritis of the elbow. This disease common present with the elbow loss of motion and in the athlete and pain in terminal motion. The proper arthroscopic surgery is arthroscopic osteocapsular arthroplasty. There are 4 components in this procedure. Here is the example of 35 years old male, golf player, pain and stiff in right elbow. He have a loss of extension. You can see that this video shows the step in, make a space, and bony work. In this body work, we remove the osteophyte in olecranon fossa and also contralateral sites such as like olecranon osteophyte resection. And in the front, we go to the bony work again and release the capsule in the front. Here is the results. This is another case of a 40 years old male, Spanish, loss of elbow motion about 40 degrees. In the investigation evaluation, you can see that he has olecranon posteromedial and posterolateral olecranon osteophytes. This is a video of arthroscopic osteocapsular arthroplasty again. You can see that this one is remove the osteophyte that have a fracture that can cause the pain when they impinge. Someone called a bony impingement, and that is cause of the pain and stiff. And also remove the loose body, and the final one is go to the front and release the capsula in the front also. Here is the results after the treatment. Another case, another case, another case, and another case. This is a good sample of the soft tissue contactor, elbow contactor from the bird palsy. For the elbow arthroscopic surgery, the benefit is not just only the cosmetic, but it also prevent the bony remodeling. The challenging factor of the elbow arthroscopy in bird palsy is pediatric elbow arthroscopy, instrument and technique, and also the recurrent. That concern on the dissect power. This is an example of the Arabian boy present with me with the elbow loss of extension from bird palsy. You can see that they have a flexion contactor, cannot fully extend, but luckily his elbow more power is quite good enough. In this case, we decided to do arthroscopic capsular release for burst palsy, and here is a immediate result, and this is a follow-up result. Here is another challenging case. 24 years old female presenting with the elbow locked in 50 degrees of flexion. She is a known case of rheumatoid arthritis that well controlled with the DMARC, but unlucky, she complicated with the ankylosed elbow. Her elbow developed bony pitch in the back of the elbow. Here is a video clip to show her motion. He cannot move, but still spare some pronation and supination. Here is the video leg cord from the surgery. For this video, you can see that we need to go in, step in, and create the space for working. And the key is I need to remove the bony pitch from the back of her elbow. You can see that in the picture, I move to the lateral gutter and identify the joint line and try to break the bony pitch. And when we can break the bony pitch and remove it completely, her elbow can move again. Here is the result immediately and the follow-up. Here is another case of the Thai male, 28 years old, present with his right elbow cannot move, but his forearm still spare some motion, rotation in there. Practically 1.5 years ago, he had a burn injury from the gas station explosion. This video shows that he cannot bend his knee, his elbow, or even extend his elbow. This is a picture that his forearm rotation still spare. And the investigation, you can see that he have a huge heterotopic ossification in the proximal medial of the joint. This is a video of the CT reconstruction, 3-dimension CT reconstruction of his elbow. And this is an axial cut. And here is a sagittal cut and also the coronal cut. You can see that the ulnar nerve is stay in the heterotopic ossification.
After general anesthesia, the elbow cannot move anymore, so we approach from the posteromedial by identify the ulnar nerve and unloop the ulnar nerve with osteotome and remove the whole HO from the elbow. After remove the HO, the elbow start to move but cannot fully extend. So we decide to do the volar arthroscope. So we use the proximal anteromedial portal for viewing and working from anterolateral portal, and use the proximal anterolateral portal for the detector. And we can switch to do the capsulectomy. And after capsulectomy, the elbow can have a fully motion.
Take-home message: arthroscopic surgery for correction elbow stiffness can expect the good promising results. The key: know yourself, know your enemy. Disease, pathology, or the lesions can make a good day for you. Thank you.